Prior to your scrub procedure, you will sanitize your hands with Hebe scrub or Hebetain or with the alcohol-based fluid. The same is with the surface where you're going to put your towel pack or gown pack on. The pack will be checked for the date, for sterility, and for cleanness, and for dryness, and for no holes. Packs are open away from you, and then towards you, and no clothing touching the drapes. Once again, the principle of not touching, away from you, and towards you. Packs may also be draped in a different method, so you may find that it may be opened not away and towards you, but to the side and to the side. When you open a glove that's specific to your size, the glove gets opened on the side and it gets slid on towards the surface. When opening a tray or a gown, you need to wear a mask. For the purpose of this video, I'm not wearing a mask because of sound problems. When scrubbing, you will not be wearing any jewelry, no rings, not even wedding bands, no watches, no friendship bands, no jewelry whatsoever, no nail varnish, no artificial nails, and your nails need to be short and cleaned before you're going to scrub. Your hair is all covered in the cap, mask is put over the nose and tied. Watch. And a plastic apron is worn to protect your clothes. The scrub is 5 minutes, it's 5 steps. Prior to the wash, you prepare a brush, you look on the watch, you open the taps, the water should not be too hot or too cold. In case of too cold, your skin dry out, it causes cracked skin and an open port for infection. If it's too hot, you're going to get blisters. Once again, broken skin, entry port for infection. You wet both arms, the soap stick better. You use your right elbow to get soap on your hand. What you do to the one hand, you do to the other hand. In between the fingers, fingertips only, fingertips, and then every single finger separately. In circle movements, cover all the skin with the chemical all the way down and 2 fingers above the elbow. Same with the other arm. You wash this arm first, so you rinse this arm first to ensure that the chemical stays on the same time for working purposes. You wash from the fingertips to the elbow. And the hand is always higher than the elbow at all times. Grab the brush. Right elbow, put soap on the brush. You brush your nails for 30 seconds. Only the nails. Rinse your fingers, rinse the brush, Put new soap on. Wash the other hand. Brush the other hand's nails. Also for 30 seconds. Wash the hands, wash the brush, drop the brush, because the hand never goes lower than the elbow. New soap, step 3. Step 3 is exactly the same as step 1, all the way down and above the elbow, 2 fingers. Step 4, right elbow with soap. And now 2 fingers below the elbow. Rinse all the soap to prevent chemical burns. Step 5. Exactly the same as step 4. Close the tabs with your elbows. In case of contamination, that means you will either touch the tab, this opening of the tab, or the metal on the scrub. You start at step 3 again, after the brushing of the nails. You drip dry and you walk to your table. You have somebody drying your apron so that your gown will not become wet when you put it on.
Surgery results in a disruption of the skin, which is the body's principal barrier against the introduction of microorganisms. Thus, the potential for infection is a major concern in the operating room, as well as during preoperative and postoperative care. The sterile field is an essential protective measure, as it creates a wide area of sterility between the operative site and the surrounding unsterile environment. This program explains the types of materials used to create the sterile field, techniques of surgical draping, and principles of maintaining the integrity of the sterile field during the operative procedure. Principles of infection control underlie both the concept and management of the sterile field. Remember, interrupting the chain of infection is the basis of infection control procedures. The sterile field serves to interrupt the transport or transmission of microorganisms by establishing an area of asepsis in which the operative procedure is carried out. The sterile field is created by sterile drapes and draping procedures that isolate the operative site at the center. Other sterile surfaces are prepared away from the operative site to ensure the sterility of sterile instruments and supplies needed during the surgical procedure. Only scrubbed, gowned, and gloved team members touch these surfaces. The types of materials used in preparation of the sterile field vary according to the operative site, surgeon preference, and agency policy. These materials must meet certain criteria to serve as effective barriers against the introduction of microorganisms into the sterile field. Whole sheets are used to cover operating tables, instrument tables, and body regions. When selecting the correct size, choose one that is large enough to provide a wide margin of safety between sterile and non-sterile areas. If reusable drapes are used as the primary material for draping, an impermeable drape or additional layers are required to guarantee a safe surface and prevent strike-through. Surgical towels are used to drape the operative site and to dry the surgical team's hands prior to gowning and gloving. When isolating the operative site, reusable towels are most often used. Both reusable and disposable towels are used for hand drying. Fenestrated sheets have an opening or window manufactured into them, which allows access to the operative site. Various sizes are available. For example, a fenestrated laparotomy sheet is usually large enough to cover the entire patient, operating table, and anesthesia screen. It is typically used for most surgical procedures performed on the abdomen, chest, flank, and back. All large drapes are fan-folded so that the operative site can be draped without the risk of contamination. Smaller fenestrated sheets are sometimes used for procedures involving the head, neck, and limbs. Plastic incisional drapes are made of impermeable polyvinyl with adhesive on one side. Applied directly to the skin, the incision is made through the drape. This type of drape protects the skin surrounding the site from contact with the surgeon's gloves and exudates from the wound. They also help prevent wound contamination from bacteria on the skin. The circulating nurse and the scrub nurse, or scrub technician, are responsible for gathering all materials needed for the surgical procedure in the operating room where they will work. Scrub personnel usually handle the sterile materials. However, non-sterile personnel may drape some surfaces. The actual draping procedures must preserve the sterility of all materials by adhering strictly to the principles of aseptic technique. Establish the sterile field with as little manipulation of the drape as possible. Place the pack on the surface being prepared. Open the outside pack wrapper away from you and carefully spread it on the surface. As you unfold the drape, allow gravity to pull the drape to a hanging position over the edges of the table. Unsterile personnel only touch the portion of the drape that falls below the sterile top, as it too is considered unsterile. Then pull the other edge of the drape toward you to create the table drape. Do not flip or shake the drape, as it may create air currents which will stir up dust, lint, and droplet nuclei. Grasp the edge of the inner wrap to unfold it in the same manner, creating the second layer. The procedure for sterile personnel who have scrubbed, gowned, and gloved is reversed. Open the sterile drape toward you first. Protect your gown by keeping it as far away from the table as possible. Protect your gloves by holding the edges of the drape over them. Keep all portions of the drape under control at all times to make sure that it is not contaminated, and remember to always drape from a sterile to an unsterile area. Walk around the table to protect your gown, sleeves, and gloves from contamination. When moving sterile items from a sterile site, avoid touching the edges of the wrapper, which are now considered unsterile. When carrying the instruments, keep them above waist level. During draping, if a sterile surface contacts a non-sterile surface, or if sterility is questionable, everything should be considered unsterile and replaced. Gowns or drapes that become wet are also considered contaminated because moisture acts as a wick and a pathway for bacteria. Every member of the surgical team has the responsibility for maintaining the safety of the environment. Both the circulating personnel, who specifically monitor the procedure and record all materials used, including prep materials, and the scrub personnel, who are actively involved in performing the procedure, must work together as a closely coordinated team. Basic principles of surgical asepsis must be strictly enforced. For example, always keep the sterile field in view. Remember, only the top surface of a covered table is considered sterile, even though a sterile drape extends over the sides. Sterile gowns worn by scrub personnel are considered sterile only on the front, from chest level to the level of the tabletop. The axillary area is considered unsterile. Sleeves are sterile only from the level of the cuffs to 2 inches above each elbow. The cuffs themselves are not considered sterile and must be covered with gloves. Make certain that each item brought into the sterile field is sterile. Though this is the responsibility of circulating personnel, the preservation of sterility during handling must be assured by scrub personnel. Movements of the surgical team should be carefully coordinated to avoid contamination of the sterile field. Scrub personnel are permitted to move only from sterile to sterile areas. Circulating personnel are permitted movement only from unsterile to unsterile areas. If the positions of scrub personnel are to be exchanged, the movement is accomplished in a back-to-back manner or face-to-face manner with an adequate margin of space between both. But neither sterile nor unsterile personnel should move with their backs toward the sterile field. To avoid contamination of the sterile field by airborne droplets, avoid talking, sneezing, or coughing over the sterile field. Talking increases air movement by inhaling and exhaling, and directions from the surgeon or anesthesiologist will be heard more easily if talking is limited. During the procedure, contaminated items are removed or covered. For example, small items are removed from the sterile field.